What's the best way to manage medication during diverticulitis bowel rest? When dealing with diverticulitis, especially during a flare-up, managing medications carefully is key to supporting healing and avoiding complications. Bowel rest often means sticking to clear liquids or sometimes nothing by mouth for a few days, depending on how severe the case is. During this time, medication management focuses on controlling pain, preventing infection if needed, and avoiding drugs that slow down bowel movements. For pain relief, acetaminophen is usually recommended because it effectively reduces discomfort without affecting bowel motility. Non-steroidal anti-inflammatory drugs like ibuprofen can also be used for mild to moderate pain, but they should be taken with caution because they can irritate the stomach lining. Opioids are generally avoided during bowel rest because they can slow down the intestines and potentially worsen symptoms or increase the risk of complications. When it comes to antibiotics, recent guidelines suggest that they are not always necessary for uncomplicated diverticulitis in otherwise healthy individuals. Instead, antibiotics are reserved for more complicated cases, such as when there is an abscess, perforation, or systemic signs of infection. If antibiotics are prescribed, they should target bacteria common in the gut, like gram-negative bacteria and anaerobes. Typical regimens might include metronidazole combined with ciprofloxacin or amoxicillin clavulate. In severe cases, antibiotics are given intravenously in a hospital setting, alongside Roman IV fluids to keep the patient hydrated. Since oral intake is limited during bowel rest, maintaining hydration is crucial. Intravenous fluids are often used in hospitalized patients to prevent dehydration and keep electrolyte levels balanced. As symptoms improve, the diet is gradually advanced from clear liquids to soft foods, and then to regular foods as tolerated. Medications should be reintroduced carefully, ensuring they do not irritate the gastrointestinal tract. Certain medications should be avoided during an acute flare-up. Opioids are best avoided because they can slow bowel movements and make symptoms worse. Non-steroidal anti-inflammatory drugs, while useful for pain, can cause gastrointestinal irritation, so acetaminophen is often preferred for pain management. It is important to remember that each person's situation is unique, and treatment should always be tailored to individual needs. Some additional therapies like mesalamine or rifaximin have been studied for preventing recurrence, but they are not standard during the acute phase of bowel rest and requiring further research. Overall, the safest approach involves using pain relievers like acetaminophen or NSAIDs carefully, reserving antibiotics for complicated cases, staying well hydrated, avoiding medications that slow bowel function, and gradually reintroducing foods and medicines as the patient recovers. Always consult healthcare professionals for personalized advice, as individual conditions and responses can vary. Following these guidelines helps promote healing, reduce discomfort, and prevent further issues.